At the Richmond Practice, Scott's desperately trying to save 6-year-old Charlie. The Wheaten Terrier collapsed earlier today.
Her chest is starting to fill with fluid. She's filling with fluid. I mean, she's bleeding out. She's really not looking good.
His family is on holiday overseas.
Yeah, get the crash box.
Charlie's condition means that he has absolutely no platelets, so that means he can't clot blood. He is bleeding from absolutely everywhere. He's in real grave danger, and we need to give him this blood transfusion now.
So we just got to go with it.
Anything is better than nothing, surely.
Okay.
It's in, okay.
It only takes a few minutes for the transfusion to take effect.
There's definitely improvement in that colour, there's no doubt about that. Charlie was starting to deteriorate quite rapidly. His breathing was getting more and more laboured and his colour was getting worse and worse, paler and paler. So thankfully, we've managed to get the blood transfusion into him just in time and he is responding.
Mm-hmm. It's just a waiting game now, isn't it, I guess? It's gonna do its job, I hope.
Yeah, well, yeah. We just have to give it some time and see if he manages to survive long enough for his red blood cell count to be replenished. But who knows how long.
If we can get that up, we may have a chance.
We've literally done everything we can do for Charlie now. There's nothing left. All we can do is hope that he makes it through the night.
I just have no clue as to where this is going to go.
I know. Hey!
Morning.
How is the boy?
He didn't make it.
Oh, you're kidding.
No. Yeah. The news for Charlie isn't good. Sadly, he passed during the night. He battled hard and you know, everyone just worked so hard with him, but he was just so unwell, desperately unwell.
Oh, poor Charlie.
And yeah, he slipped away in the night. So, yeah.
I'm absolutely heartbroken to hear that Charlie's passed away. Yeah, I don't have many words at the minute. Oh, it really sucks.
Yeah.
And you do so much and you try so hard. He's left a hole behind. And it's, yeah, it's gonna take us a while to get over his passing, because he was a special boy and we're all gonna miss him.
Done our absolute best. Yeah. I know.
Sucks.
It's very hard to break the news to Emma that Charlie had passed. She'd put in such an amazing Herculean effort to keep him going until I got into the practice and was there by his side constantly. She's devastated that he's passed on. Well done. Well done.
He was a brave boy until the end, as he was with everything that life threw at him, but he tried his best and he fought hard. And I just hope now he's in a better place.
Hello.
Hiya.
Hey guys, how you doing?
Yeah.
Oh, thank you.
Thank you.
Bit of a rough day, huh?
Yeah.
Just sucks, you know?
It can't just be your veterinary knowledge that makes you do this job. It can't be. You've got to have a level of compassion. You've got to feel it right in here. Poor Charlie. He's had a lot going on and a lot going wrong, sadly, but flipping fought, you know.
Oh,
he went as
didn't
long
he?
as he could.
He really did.
He did everything he could. He just got a bit tired.
Yeah.
They're your friends. They've become your friends. You get to know the cats, you get to know the dogs, you get to know the rabbits, you know. You get to know them all. And then when it doesn't end how you want it to end, it crushes him, of course it does. He's only human at the end of the day, you know what I mean? He's a pretty decent human, but he is only human, you know, and he's got a heart as big as anything.
Cup of tea to Charlie.
Yeah.
So Charlie.
Thanks, Mass.
Everybody, the vet's here.
Hello, everybody.
Good to see you. Hi.
Hello. Hi, Tom.
I'm very glad Scott is here, because if we were doing this on our own, I would be very concerned by now that things hadn't done exactly what the textbook said.
Let's just have a little feel. Wow. That's one full dog. Hey, you're about to pop, aren't you, sweetheart?
So I'm so grateful that he's here, making sure that we won't be left alone and that she won't be suffering.
All right, so I'm just going to have a little look.
Good girl, brave bunny.
Cervix is just starting to dilate. Now, I can also feel the puppies' heads are about this big. So they may be like sort of the size of a large plum. So that's how big her cervix has to be in order to pass the puppies. All right? You look nervous, you're right.
I am nervous. I suppose, yeah, I'm worried that won't get big enough to get those heads out.
Yeah, so we just need to work together. We need to be patient and we need to make strategic decisions in order to get the best result possible.
It's felt.
3 hours later, and Scott's worried the labour is moving too slowly.
We should see more contractions, we should see more attempts at sort of getting these puppies out, and we're just not seeing that. So what we have to do is just be careful that we're not letting it go on too long, because of course then we can start having worries and concerns about the puppies. We should definitely have had a puppy by now. And I'm just starting to get concerned that this puppy is getting a little distressed.
The chances of a successful home birth are fading fast.
A lot more nerve-wracking than I thought it would be. And I'm amazed how close I feel to her. You know, just the fear behind her little eyes. I do feel for her. Just whatever you can do that's the best for her and the pup.
Finally, Scott is forced to make a tough decision. He's now convinced a caesarean section is the only option for Bonnie. By the time they arrive at the practice, Bonnie has been in labour for 7 hours.
Hey, Nath.
Nurse Nathan has already arrived to help out.
Thank you very much for coming quite so quickly.
Oh, sorry. Sleepy time now, okay? So say goodbye. So you guys are gonna see you go to sleep and then we'll get you to pop up to the waiting room, okay, while we get the surgery done.
I hope that everything's okay. Because you never know. I mean, maybe there's something wrong.
It's all going to happen pretty quickly now.
Okay.
I really hope that everything's good and that there's lots of little ones there.
Okay, all right, baby. Okay, here we go. Just wish I didn't have to do this, poor thing. Just be very careful with this incision because the babies are very, very close and they're very packed full in this tummy of hers. All right, babies, out you come. Okay, who's on baby catching duty? Ems?
I'm on.
Okay, all right, okay, you ready?
Yep.
Okay, there you go.
All right, little pups. Oh, come on, little pups.
Okay, do the swing if you need to.
Yep.
And like rub harder than you think you should.
Emma is trying to clear the fluid from the puppy's throat and nose to help it start breathing.
Any luck?
No, not yet.
The second puppy is also grey and lifeless.
I'm really worried about the health of the puppies. They should absolutely be making sounds by now, and they're not.
Come on.
They're not crying, they're not doing anything. I'm just so concerned that this is going to end really badly for Sophie and Tom.
Come on, little pups. Come on.
With Emma and Nathan desperately trying to kickstart the first two puppies' breathing,
Ask Sophie if she can come down.
Scott has no choice but to enlist the terrified Sophie to help puppy number 3.
So I'll give you the puppy, and then what you're gonna have to do is, careful of don't touch anything green. That's it, pull back. So, don't touch that either. No. Just stand where you are, stay still.
I'm quite anxious. I've never done this before. And the thought of their life being in my hands is nerve-wracking.
And what you're gonna do is you're gonna rub it really firmly on the chest, okay, really firmly and stimulate. Ems, can you help Sophie with that one? Just watch whilst tell her to do what you're doing.
Yep.
Have you got movement in yours yet, Ems?
Yep.
Yeah, Sophie's just taken over mine. I'm just taking over hers.
Do we keep doing it after?
Yeah, we just keep doing.
Keep going.
I've never done anything so terrifying in my life. This evening cannot bring any more shocks and surprises, and it's just incredible.
But there are more shocks to come.
Oh my God.
Have you got a fourth one in there?
I've not just got a fourth.
You got a fifth?
I've got a fifth as well. So, oh gosh, I might even have a sixth. Right, okay. Someone needs to brush up on his ultrasound skills.
Oh my goodness.
Come on, open your mouth, come on.
We've got mouth movements from everyone.
Oh, good. It's nice to see that, isn't it? To see that. mouth movements.
Remember to keep rubbing. We need to keep him stimulated. We don't want any of this to stop.
Vet nurse Gina has also arrived with another much-needed set of hands.
Ems, how's it going out there?
And it
hands
seems
up,
the
everyone.
team effort
1,
is
2,
finally getting
3,
results.
4, 5, 6. Breathing puppy.
Hey, good job. Well done.
And then, at last, the sound they've all been waiting to hear.
Oh, I did hear a
We've got
squeak.
squeaking. You gotta wriggle away, little dude. Come back. I'm feeling so emotional. I'm welling up. It's so special that we're able to bring in life. It's a privilege. It's a complete privilege that we're able to do it.
Yeah, I do feel like I'm missing out. I can hear those cute noises, and I'm yet to see them. But they sound gorgeous. And as a vet, you love animals and cute little puppies, and 6 of them in a row. It's incredible. I mean, it's incredible.
Hi, love, it's me.
Sophie can't wait
Okay, so
to share the
Bonnie's
news
fine,
with husband
and,
Tom, who returned home
there were 3
earlier to look
puppies,
after
and
their
they're
3
all
children.
out, but there's actually more than 3. There's 6.
My goodness me. That's unbelievable.
It's unbelievable, I know. They're so beautiful.
Clever, clever girl.
We're squeaking, we're wiggling,
Oh, man.
we're making me cry.
Oh, you're fantastic.
It's 4 a.m. when Tom arrives back after finding another babysitter.
How amazing. Oh, they are tiny.
Yeah.
Oh my goodness, they're absolutely perfect. I can't tell you how happy I am. I'm so pleased. I'm really pleased that Bonnie's doing well as well, because, she's done a big job tonight. It's been a big day, and I think she's been amazing. 6 perfect little
really
puppies.
worried when it had to be a cesarean. Really worried, and to have such a wonderful result, it's just perfect.
Yeah, it's amazing.
She's still sleeping, but she's here.
Oh, that's just amazing.
Thank you. We feel like she's in very safe hands.
Yeah. Well, actually, very pleased, of course, you were there right from the start, because, if you hadn't been there, I'm not sure we would have seen all the 6 puppies and Bonnie the following morning. So it's been amazing. So thank you very, very
No,
much.
it has been
Wow.
amazing.
It has been
We're
amazing.
forever bonded now. Hey?
Hey, is that you coming back? Hi, Bonnie. Beautiful puppies.
I think she can probably hear them.
We've got a big family to look after now, so you must get better.
Yeah.
She does.
Have a few hours of rest, and then I think it's all going to start, yeah?
I think 6 babies at once.
Oh.
Can you imagine? So you guys want to go and see the kids, get some
Yes.
sleep,
Yeah.
Yeah.
and we'll see you tomorrow.
6 puppies.
I know. What a result.
A result.
Let's go and tell the kids.
Yes.
Tomorrow, Bonnie will be introduced to her new babies.
Morning.
Morning.
But tonight, she needs to rest and recover from the surgery.
And doesn't that make it all worthwhile?
It really does.
Scott and Emma will be keeping an eye on them all until the morning shift arrives.
What an amazing, exhilarating, at times scary, but fantastic experience. And people might think that we as vets and vet nurses must do this all the time. Honestly, we don't, and it's just as special for us as it is for Sophie and her family.
Someone's got to be serving coffee in Richmond, surely.
At 4 in the morning?
There must be somewhere.
You've got your babies here.
Here we go.
I told you they were coming.
Oh, look at that little bundle of joy.
Next day, after just a few hours sleep, a weary Scott's back at the practice to check up on Bonnie and her 6 puppies.
So 2 boys, 4 girls.
Practice manager Maz is the latest to fall under their spell.
That's a little, very vocal girl.
Yeah, one of them's standing right next to you.
Yeah, I know.
Push it if I were you.
No, I won't. Look, hello, baby. Oh, I know. Good girl, you're cleaning them. Clever girl. Those maternal instincts are really kicking in now, aren't they?
Last night, after she recovered from the anaesthetic, Bonnie really wasn't that interested in her puppies, fair enough. But this morning, thankfully, she is all over them. She absolutely loves them, and she's being a great mum.
I feel really sorry for him, and there are times when he's just, seems to be struggling, seems more lethargic. He's still eating, but he's playing less. And then more recently, as I said, the coughing is quite worrying to me.
It's thought that maybe 1 in 100 cats in the UK can suffer with asthma, feline asthma. And when we're trying to manage asthma, obviously asthma can be potentially life-threatening. So what we need to do is get ahead of it, diagnose it early, and then have them on certain levels of treatment. Asthma in cats does present in a fairly similar way to people. People are short of breath, their respiration rate's high, they're just struggling to breathe, struggling to survive. And exactly the same thing can happen in cats. If we do find that it is asthma, then it can be caused by so many different things. So we do need to sort of mine down into those, find out exactly what causes might be present, and then how best to manage it. But first, of course, we need to effectively diagnose.
Sure. OK, that sounds like a good plan. Thank you.
And just remind me, because I don't want to embarrass myself, I know that you're a doctor. What kind of doctor are you exactly?
I'm an ear, nose and throat surgeon.
Yes, yeah, of course you are. Yeah, that's not intimidating at all, is it? No. Right, I really have to look after you now, Edwin, don't I?
You do. I feel a little bit sorry for Scott. It's not going to be easy because obviously I'm coming from a specialist background, but I know he'll do the right thing, and Scott's an excellent vet, so I'm very happy to leave Edwin in his capable hands.
And one thing I must say is that I have always had a soft spot for animals with human names. I've got the dogs Betty and Dave, and actually the first cat that I ever treated in the UK was called Colin, which I loved. Yes. So Edwin is right up my street.
Toss is perfect.
Well, he certainly is.
I've never known a cat to be quite so soft as Edwin is. He never scratches. He wants to be with you the whole time. He talks to you and loves to lie on our pillows at night when we're sleeping. Bye-bye, Edwin. You be a good boy today, and I'll see you later. Hand you to Scott. There we go.
There we go. Right. Come on, handsome boy. No pressure.
Be good, both of you.
Right, we'll try. We'll try. Say bye, Mummy.
Bye, Edwin.
I'm going to sneeze in a minute. Oh, God. Edmund, I got a little confession to make, is that I'm slightly allergic to long-haired cats, so I'm getting relatively similar clinical signs to you right now.
3-year-old Edwin is coughing and struggling for breath. But Scott's concerned the cat's runny nose could be something serious.
Cats do die because of asthma attacks. There's varying degrees of severity, of course, but the worst case scenario is yes, they can be alone, they can be stressed, they can have an attack, they're unable to breathe, and they can die. He must behave so well, this cat.
Such a good boy.
Yeah. Certainly the rag doll coming through in his easygoing
yes,
nature.
very much so. If they could all be like this, our job would be a lot easier.
So today it's about trying to diagnose the condition and see how far down the line towards asthma Edwin really is. So first of all, we're going to do some blood work. We're going to be doing some x-rays as well, having a look at the chest and seeing if there's any changes.
All right, buddy. Oxygen on.
X-ray. So the news is that it does look like the early stages of asthma. All the tubes leading down to the airways are just a little bit thickened. It shows they're a little bit inflamed, but I do think looking at this X-ray, there's definitely lots we can do to help manage this condition.
But suddenly, what was a routine investigation has turned into an emergency.
He's just not breathing the best at the minute.
Edwin has crashed on the table.
Okay, so you just have to start giving me some positive air pressure.
Yep.
Yeah, we have to inflate the chest to just get a better clarity to that lung picture. But by doing that, he just stopped breathing for a little bit. When you have an animal that tries to die on you, you go into autopilot. Have we got the drops that go under the tongue somewhere? And all that training that we've done just kicks in, and straight away we start giving him some injections to try and stimulate his breathing. And at the same time, giving him positive air pressure, just putting some air back into those lungs, getting him going again. That was him. Yeah, it was him. Is that, it wasn't you, was it?
No, it wasn't me.
There we go, good boy. Oh, dear, okay. So that's a nice breath there. So, yeah, he just decided to... Did someone just switch the lights off? Can you switch it back on, please?
But just as the tension starts to subside,
You're kidding.
there's another unexpected setback.
I think the power's gone.
The power's gone. Automatically, there are swear words going through my head, but you've just got to get on with the job. You have to try and not panic. It's tough.
Just keep your wits about you and focus on the cat. Keep the ISO off. Did someone just switch the lights off? Can you switch it back on, please? Just keep your wits about you and focus on the cat. Keep the ISO off.
At the Richmond Practice, Edwin the cat has just been revived after crashing on the X-ray table. But now a power blackout has plunged the treatment room into darkness. Scott is trying to keep everyone calm.
Finally, we get Edwin breathing again, and then just out of the blue, the power goes and we have absolutely no light. The only light I've got to look at Edwin with, the emergency lighting. Insane. We'll check the power box and everything is up. Whole street's off.
The whole street. You're kidding.
Okay. The one bit of monitoring equipment we've got is on battery. Thank goodness. Okay. Well, we're not going to be able to do anything more until we have light.
No.
Yep.
For second-year vet nurse Jess, this is a confronting lesson.
It's just a panic, really. For my first time experiencing something like that, it's a bit of a shock. They train you how to deal with these situations, but you're never really properly prepared for it.
Oh.
Hey. Hey. Let there be light. And a breathing patient.
More importantly, so.
Yes. Good boy. Right, now we can see you again. Let's do the next step.
To try to find out more about the state of Edwin's lungs, Scott now wants to carry out another procedure.
Just as we go to perform the bronchoalveolar lavage, which is putting a tube and then fluid down into his lungs, Edwin decides to stop breathing again. There's too much at stake here. He's far too compromised, and there's absolutely no way, when a cat isn't breathing, am I going to put fluid down his lungs. We're going to wake this cat up because he's just not stable. We're just not in a position to go any further at the moment. And doing another procedure which could further compromise his breathing is just not a good idea. Not a good idea for him, certainly not a good idea for us. All right, it's okay, it's all right, I know. Gave us a fright there, didn't you? We know how much Lisa loves this cat. He's certainly not going to die on my watch, I'll tell you that. But yeah, it's hairs on the back of the neck stuff. Right, so a very complicated case just got more complicated, okay? Yeah. So you guys need to watch this cat like a hawk, okay? No one leaves the side of Edwin this afternoon. If you need a toilet break, tag in your mate. I was very proud of Emma and Jess. Jess, it's the first time she's seen anything like that. And rather than cry or shake or be in the corner, she was actively participating in resuscitating Edwin and bringing him back to life. She's a good one, that one. Watch this space. This is what we all trained for, and you both did excellent, really, really well. So good job, good hustle.
Any situation like this, the few hours afterwards are always the crucial ones. He's still not fully recovered. Yeah, this is us set in for the afternoon now. When you've got a critical patient, you don't leave it side. Hi, buddy. How are we doing? A little bit better than this morning. You ready to go home? I need to take you out of your litter tray, though, because you're not helping me being stuck in there.
As for Edwin, it's been 5 hours since his near-death experience.
Hello, buddy.
Here he is.
Here's a handsome guy. Look who's that. Where's Mummy?
Scott's not looking forward to breaking that news to Edwin's owner, Lisa, who just happened to be an ear, nose and throat surgeon.
So, yeah, eventful day. He gave me a bit of a shock today because we went through the process, took the bloods. Blood's beautiful. We then went to X-ray, and just after that, he stopped breathing. And then he decided to not breathe for quite a considerable amount of time. So he had to do external air resuscitation, just basically filling his lung.
Well, with my animals, I have to say nothing surprises me, but obviously Scott and his team are consummate professionals.
Lisa's taken it well, but Scott's decided not to give too much information.
Although I'm always completely honest with clients, sometimes there's maybe a little bit too much honesty, and I wonder if we say that we were watching the cat recover in darkness because all the power had gone out, might have been a step too far, so I think I might tell her that tomorrow. I think you and I thought maybe it was at the milder end of asthma. Yeah. The way he's responded to just basic breathing under anaesthetic makes me think that it's much more severe than we first anticipated. So I'm going to be recommending to Lisa that we start with a puffer spray, an inhaler. Just something to be able to provide Edwin with a medication which will cool down the allergic reaction, cool down the inflammation, and get him breathing a little bit easier.
What do you think of that? Too bad? Indifferent.
Yes.
Oh, that's okay.
It's not overly impressed.
We will see an improvement,
Sure.
which will mean that we shouldn't get caught out by an asthma attack in the future. So although a scare for me today,
Yeah.
I think the long term is actually pretty bright for him.
Can you hear that, Edwin? Oh, thank you very much. Thank you.
I think he's in good hands.
We've got a diagnosis, we've got a plan, and we'll carry on from there. Okay.
All right, well, mate, your time is done, and I'm really glad that I've been able to send you home in one piece after the scare.
Well, thank you so much.
Today?
I'm sorry he caused you so much trauma.
Oh, no worries, mate.
I'm sorry.
I really hope that he's going to get in this box a
Yeah.
little bit easier than he got out.
In you go, good boy.
Boy.
Good boy. Right, let's get you home and get you some supper.
Take care.
Okay,
Bye-bye.
all right, take care, bye-bye.
What's happening? Eh? Just grab a stethoscope, mate. Just one more. Okay, good girl. All right. Can feel a heartbeat there.
Yep.
Okay, good girl. Absolutely heart-stopping. It's just stress, yeah. She's just stressed. These are the moments as a vet you dread. You're doing what seems to be a minor procedure on an animal, and then they drop. My mind's racing, but I act very calmly. But at the same time, I'm thinking, what the hell just happened? Open the window. For a little creature, they're very prone to stress. So she just needs to get a good gulp of breath. Hey? There you go, that's it. Good breaths, good girl, good girl.
Is that normal when they get stressed? That's what
No, that's not normal, no. But she's basically fainted is what she's done, so haven't you? Hey?
You can't imagine how I felt when he said she's breathing. I was so relieved because I had a flash in front of me thinking that that's it, I've lost my baby.
Hey, you gave me a heart attack.
You? I didn't expect anything like that to happen.
Good girl. There's Mummy. Look at Mummy. Look at that beautiful face. There you go, and you're back.
Good girl.
Right, good girl. There we go. Let's put you there. Oh. There you go. You scared all of us. You're right. I had a heart attack as well. I know. Ooh, that was close. Yeah. All right, so the issues then with little Chippy. What's going on there?
Yeah, about a week ago, I noticed her underside of her belly was slightly swollen. It looked really pink on one side and not so much on the other, so I'm guessing that there's something wrong there because otherwise it would be on both sides, right? If it was, yeah, so maybe we could check that out
absolutely.
as well.
After the lessons learned with Speedy, I decided that this time around we were going to leave Chippy in her cage and try and capture her that way. Let me have a little feel back here. So can I get you just to hold that leg? Mm-hmm. That's it. And Riaz, if you hold that leg.
No worries, mate.
Nice and gentle. Let's have a feel. Manpreet, I have found a lump. Okay. It is a solid mass and it is present in her mammary tissue, basically the breast tissue of your chipmunk. So it looks quite angry.
Okay.
Yeah, that is a concern.
She's my little baby and it's the size of a pea now and we don't know if it's okay, if she'll be okay or if it's something a bit sinister.
Good girl. So I know you're very worried about your little princess, but we just need to take her to the practice, have that anaesthetic done, remove that nasty mass, and then wait and see what the results show.
Okay, brilliant. Thank you ever so
All
much.
right, no
Thanks.
worries. Thank you. No worries. Okay, let's go.
We had this traumatic experience with Speedy, and I never thought that would happen with her. So there's every possibility something could happen with Chippy as well.
All right, so we'll get off to the clinic now, and I'll give you a call just as soon as she's woken up.
She might go into shock. She might not react to the operation too well. I'm not sure. So I am really nervous.
Hi, Kirsty.
Hey, Kirsty.
Oh, Chipmunk.
Chipmunk, Kirsty, Chipmunk.
Meet the chipmunk.
Come on, let's get you downstairs.
Big day.
Okay, guys, so with this we have to be quite efficient because we've got a little mammal that's prone to stress, as we certainly learnt this morning. Don't need that again. So what we'll be doing is I'm going to try and grab this little lady as gently as I can, pop her underneath the canister, we'll be gassing it down, and I'll be removing the mass as quick as possible so we can wake her up and return her to her beloved owner.
Sounds ace.
Sound good?
Good.
Yep, let's do it.
Let's go for it. Anaesthetics and surgery in small animals is always a risk, but chipmunks, they're so small and delicate, of course, it's even greater risk. So we need to make sure that with this procedure, it's as quick as it can be and she can recover as quickly as she can. Go right up to 5 to start with because she's light. With a lot of animals, we can actually give anaesthetics via an IV line or straight into their blood supply. But with the chipmunk, their blood vessels are very small. So instead what we're going to do is an inhalation anaesthetic. She'll breathe that in and then she'll be knocked out and ready for surgery.
I think it's my least favourite way.
Well, I'd like to see you try and get a vein on this one.
I think that'll be a challenge.
Let's take her out and get her straight onto a mask. Okay. Let's see. What I can see here is a very angry looking mammary mass. So she's got a little lump in her breast tissue, which is quite concerning because she is an older chipmunk and therefore older people get cancer more regularly, unfortunately. And in this case, I think that might be what it is. So what we need to do is to remove it, but at the same time remove enough tissue around the outside that if it has spread a small amount, then at least we're taking it away. We're doing the job once and doing it right. Okay. Happy, Sam?
Yeah.
Yep. Yeah, it's a hard lump and actually pretty big. So I've got the lump out completely and I can feel there's a nipple there and then underneath is this hard lump, hopefully surrounded by healthy tissue, but we'll have to wait and see what the pathologists say.
It's quite a big lump, isn't it, for a little chipmunk?
It really is. I mean, if you think how big that is comparative to this animal, it's about half the size of its head.
Yeah.
So for me, that's a pretty big lump. Yeah. It's pretty difficult actually to suture up an animal this small because their skin is paper thin. So let's throw up its own set of difficulties. So as you say, Sam, we're not out of the woods yet.
No.
To have this little one recover.
Wake her up.
Yes.
There we go. Do you want to go straight back into her box?
Yeah, that'd be great. Yeah, could you? Thank you. Ooh, ooh, what's that?
It's amazing how quick they wake up, isn't it?
Yeah, it's incredible. Fast metabolic rate. Okay. You're ready to go back in. You got there?
Yep.
Good girl. Sit. Right. Good. No chipmunk deaths today. I can't wait to deliver the news to Manpreet that Chippy has got through the procedure and has woken up beautifully. I know how worried she's been about this, but now I need to also tell her that that worry continues until we get the results of the pathology back from the lab. Well, Mum's going to be so relieved. Yeah, she is. Yeah, she is. right, sweetheart? Hey? Ready to see Mummy? Yeah? Should we go and see Mummy then? Hey? Let's go. Come on then.
It's been a bit nerve-wracking because, of course, I didn't know, how the operation's going to go. So it's been a long wait.
Here's Mummy. Hey.
Oh, hi.
There's your little lady.
Hi, sweetheart.
Say hi, Mama.
Oh, bless.
So surgery went well.
Oh, brilliant.
And we've removed that mass in its entirety, so now it's just a waiting game. We need to find out what it is. The pathologist will give us an idea of that, and then we work out if we should be worried or not. But the good news is at least that I've removed the whole thing and the tissue around it, so hopefully it's good news.
Yeah.
All right.
Okay. I was so nervous before, but now it's such a big relief to have her finally back with me. I'm just looking forward to taking her back home. Okay, bye-bye.
Bye, all the best. Bye, Chippy.
Hey, baby. Mommy loves you.
Hi, my
Star.
pretties. How are you?
Good,
Great to
thank
see you.
You too, come in.
Thank you very much. Hello, Chippy. How are you, sweetheart? You okay? Hello, gorgeous. How's she been?
She's been okay, she's been really good. She was a bit quiet for the first few days.
Okay, good girl. There we go. See you. It looks like it's healed quite well.
Mm-hmm.
The only thing is that I do feel that there's a little bit more of a lump that's developed further down.
And that wasn't there before?
No. I never expected to find another lump. All I was doing was to make sure that the suture line had healed well and that the lump that I previously removed had gone completely. And the unfortunate thing is the results from the lump have come back, and it's come back as not a very nice type of tumour. And it's already spread out into the tissue surrounding. I think it's a good chance that, sadly, this will take her quite quickly. And the fact that it's already spread the way it has, it's really not good news at all, I'm afraid. I'm so sorry.
Poor thing. So do you think she's in pain at the moment then, or?
I don't. I feel, you're still very active, aren't you? I don't think that she's in pain, but this tumour is likely to progress quite quickly. I really wanted it to be okay.
I know. I don't know, in my mind I just thought, oh, she's had the operation and she'll be
gone,
fine.
and you've given us such a wonderful life, you really have. And what I love about you is that this is a little tiny fairy creature, and people might go, oh, it's only a chipmunk, but it means so much more to you.
Of course, she's my baby. It's like my little kid.
I know.
That's why it's so heartbreaking, because she's brought us so much joy in the last 4 years.
She knows how much you love her, and I know how much you love her, and you just need to keep doing that, okay?
Yeah.
Because she's lived so much longer than she would have in the wild,
Yeah.
by being cared for so beautifully by you.